Sokol.
I'm great. How are you tonight?
I'm good. So glad that I get the chance to talk with you. Real quick, though, before we get started, I just want to say that this session was developed by Vindico Medical Education with educational grant support from Genentech, a member of the Roche Group, and Sanofi and the Regeneron Pharmaceuticals. More project information can be viewed in the link in the comments, and I'll get that posted a little bit later. You want to go ahead and introduce yourself and tell us all why you know so much about CSU, also known as chronic spontaneous urticaria?
Sure. Thanks so much, Laura. I'm happy to be here as well. My name is Kristin Sokol. I'm an allergist immunologist. I work in the DC area, and I see tons of chronic spontaneous urticaria as well as lots of other allergic conditions. So again, happy to be here. Happy to answer
Uh,
your questions.
awesome, thanks. Okay, we'll get started here. What does the journey getting diagnosed with CSU usually involve, and why does it take a long time for some people to get diagnosed?
Yeah, so great question. Chronic urticaria is this kind of very, let me just say, annoying condition, right? You get hives, you get swelling, they come and go, and for seemingly no reason at all. They can come any time of day, any time of night, and there's really no identifying triggers. So, but patients get very frustrated because when you see hives on your skin or you're swollen somewhere on your skin, oftentimes the natural reaction is to want to know exactly what caused that, right? So
Sure.
they will go to different doctors, they'll go to places like urgent care or the emergency room or their primary care physician, kind of seeking out answers for why they keep getting these hives. And sometimes the wrong testing will be done or the wrong treatment will be given just because the doctor is not aware, or the doctor, whatever healthcare provider they're seeing, is not aware of exactly what they have. And hives can be confusing. So that's why sometimes it'll just take a really long time. Another reason is because sometimes the patients will get these episodes of hives, but hives come and go very quickly. So they might show up to their physician
Mm.
and they don't have anything on their body. So it's very hard. But if they don't have pictures of their hives or their swelling, their condition might be brushed off, or your body might be looked at and said, well, there's nothing there right now, so you're fine. And oftentimes patients will be given band-aids for hives, and that, by that I mean things like oral steroids or other
Sure.
medications that just don't work as well as the treatments that we do have available, and they never make it to the right people. So
If it could be considered CSU, like, is there an amount of time that goes in between them? You know what I mean? Like, if somebody gets them, let's say they get them four times in 4 months, could that be still considered CSU, or is it like back to back to back?
So we usually, the description or the definition of chronic spontaneous urticaria is hives or swelling episodes almost daily for about 6 weeks or more. When the hives episodes are very short, a couple days at a time, and then don't come back for a while, that's called an episode of acute urticaria or short
Okay.
urticaria, right? So that is a different
Okay.
diagnosis. Um, if the patients are having hives that are lasting several weeks at a time, even if they haven't quite reached that 6 week mark and it's recurrent, that's another reason I might diagnose someone with chronic spontaneous urticaria.
Awesome. What does it mean when allergists say that CSU is autoimmune like? And is CSU an autoimmune disorder? And are people with autoimmune conditions more likely to get CSU?
All great questions. So CSU is likened to an autoimmune disorder, and this is how I describe it to my patients, because autoimmune disorders are kind of scary and they sound scary to patients, but it is an autoimmune-like disorder which really only affects your skin, okay? Because when we think of autoimmune disorders, sometimes we think of it affecting a lot of organs in our body. The
For sure.
only the only organ that chronic spontaneous urticaria affects is our skin. Um, and the reason we call it autoimmune is because it's a condition where the body's immune system mistakenly attacks its own skin cells. Okay, so just like in any other autoimmune disorder where our body mistakenly attacks like liver cells or kidney cells, this is just attacking cells that live right under our skin.
Awesome. Let's see here. What should patients say or ask during their doctor visits if they think they might have CSU?
Yeah, so really important to bring a good history, a good timeline for your doctor or the healthcare provider that you're seeing. When the hives started, where they're located, how long they last, if any swelling is involved with the hives, And if they do think there are any potential triggers, that's important to note as well. Even though chronic spontaneous urticaria, we don't find specific causes or triggers, but it is important to note those. Pictures are worth 1,000 words. So if a patient has pictures of their hives or pictures of their swelling, we want to see them for sure so we can lead that patient to the right diagnosis.
Sure. So just documenting everything,
It's really
you know.
really helpful. We
Yeah.
don't need to know every single
Yeah.
thing, but yes, it's helpful to have a good history. It's really important to like know what medications you've tried, what
Mm.
medications you've tried over the counter for this condition, what has been prescribed for you, if anything, for this condition. Some patients, it's frustrating because we want to help them get the right diagnosis, and we ask what treatments they've been on, and they say, oh, that pill, right? It would be very helpful to know, what pills did they try or what medications they've tried. Yeah.
Is this something that could ever go away? Like, or is it, you know what I mean? Like if they're on medication for a while, is it something that can eventually go away?
Yes. So every patient with chronic spontaneous urticaria follows a little bit of a different path. So sometimes we see patients that will show up with hives and or swelling kind of every day for a really long time, like months on
Hmm.
end. And then it'll just go away. And then maybe it'll come back in a few years. But in that time frame, they might not have had any hives or swelling at all. And this might happen throughout their lifespan. Then we see other patients that have, episodes that are very mild but last kind of all the time. We have patients that are on medicine and everything's pretty calm, but then they'll have a trigger, like they're really stressed at work and they'll have a flare of their hives, or they go on vacation and they're, exercising in new humid weather or something, and that might trigger their hives. So we see a lot of different kind of pictures. Chronic urticaria is more common in women, and we see a lot of like hormonal changes cause flares of hives. So like pregnancy, for example. So, or when they first start their menstrual cycle or menopause, right? So there might be times in their life when the hives really, really flare and then they go away.
Yeah.
Go
So,
ahead.
no, I was just saying that is somewhat like that's autoimmune like as well. Like I know a lot of people with RA, like they'll go into remission when they get pregnant, right?
Right?
So a big hormonal shift
Yeah.
happens and then things change.
Right.
So it sounds like it's very autoimmune, it
Yeah.
is coincides with all the things that happen with my RA, things like that
Right.
too. So,
Right.
yeah,
Right.
interesting. All right. The next one that I have, people who are diagnosed with CSU often ask if they will get food allergy panels done, but that is not part of the doctor's diagnosis and treatment plan. Why is that?
Yes, a lot of patients will come in asking for, extensive food allergy testing. However, the reason we don't do that is because, well, once we know that we're dealing with a patient that has chronic spontaneous urticaria, there really is no one cause, like a food you're eating or a medication that you're taking or something that you're being exposed to. That is just not part of the diagnosis. Now, when we do food allergy testing also, I just want to remind everyone that we're testing for true IgE or immune mediated food allergies, right? So that is what is available. Skin testing, blood testing, we're testing for those immediate type allergies. And by that, I mean, when a person eats a food and they're allergic to it, they would get immediate symptoms: hives, swelling, trouble breathing, vomiting, anaphylaxis. When they're not eating that food, they should not be getting those symptoms. So if a patient comes to me and tells me, oh yes, every single time I eat a peanut, I get hives. Okay, well, that is consistent with a true food allergy, not chronic urticaria, right? So we probably already ruled out that peanut allergy or tried to diagnose that peanut allergy and not diagnose this person with chronic spontaneous urticaria. If patients are having hives every day or, every other day, every third day, and it's not associated with any food, then there's no reason to do food allergy testing.
Okay. What should patients say or ask during their doctor visit if they think they might have CSU?
Great question. Just really, can come with a really good history, all the medications that they've tried, but also just asking about like their future, right? What is it going to be? What is their quality of life going to look like with this disease? Allergists are very well trained in treating and caring for patients with this condition. And we treat the patient as a whole. So, right. So I don't just give them medicine and send them off, right? I ask them questions about their sleep, about their work, about their children, right? Whatever the situation is, because chronic urticaria really affects us as a whole person. And so asking those questions to me is helpful, or telling me those things is really helpful. And I can help guide the treatment. I see that someone's asking, like, are there any words of encouragement, right? And I would say yes, there are treatments for this condition. If the over-the-counter stuff is not working, there are prescribed treatments for chronic urticaria, and allergists are happy to see you and help you with this. We talked about in the beginning, patients will sometimes take a really long time to get to a specialist who knows how to care for this condition. So
Well,
there's a lot of information out there too.
yeah.
So
Well, and hopefully these lives are gonna help people, bring awareness, so and they can
yes,
get the relief that they so deserve and need.
definitely.
Well, thank you so much for taking the time to chat with me. It was lovely.